my name is Bonnie and I'm 10 years old. Why is high blood pressure dangerous?
My name is Mark Garnick and I am a physician at the Beth Israel Deaconess Medical Center and a faculty member at Harvard Medical School, both of which are located in Boston, Massachusetts. And the question is, what is blood pressure and why is it bad if you have high blood pressure? Blood pressure is one of the most important vital signs that is a requirement for life. And the blood pressure is a measurement of the force with which blood pumped from the heart is pumped through the arterial circulation in the body. And what the heart does is the heart pumps blood through the arteries, through the main artery called the aorta, and that aorta then branches off to other organs in the body, including the brain, the heart, the kidney, the liver, the lungs, the intestine, the adrenal glands, the muscle, the skin, the bone. So every organ in the body needs blood for its nutrition and for its oxygen content. And in order for those organs to receive blood, in order for those organs to receive these nutrients, it requires blood. And in order for that blood to get there, it requires some force, so-called pressure, to get throughout the body. And the force with which the heart generates the blood through these organs is called the blood pressure. And what happens is, if the blood pressure is too high, there is excessive force and excess stress on these arteries or these blood vessels that serve these organs. And what can happen is this high pressure, if the blood pressure is too high, ends up damaging the lining of the blood vessels, can actually cause expansion of the blood vessels, and can actually cause bursting of the blood vessels. Moreover, high blood pressure can be associated with damage to various organs, such as the kidney, the heart itself, and the brain. So having pressure in these blood vessels that is over the normal typical pressure can lead to damage of these blood vessels and can actually accelerate the development of atherosclerosis, or hardening of the arteries, which can lead to the major complications of high blood pressure, which is a heart attack, which means that the portion of the heart is damaged and is dying, or some damage to the brain called a stroke, or some damage to the kidneys leading to kidney failure. So high blood pressure is a very, very common disorder. Fortunately, it's very readily treatable, and it's very readily measurable by taking a blood pressure cuff and measuring the two pressures that indicate how effectively the heart is pumping blood through these major blood vessels. So as we get older, many people end up developing some high blood pressure. And fortunately, there are many, many different medicines that can be utilized to lower the blood pressure to acceptable levels, to decrease this cycle of damage to the blood vessel, damage to the organ. And we're now looking at varying levels of blood pressure, and what we thought was a so-called normal blood pressure in the past has actually been reclassified as an abnormally elevated blood pressure. And we're trying to utilize mechanisms to decrease blood pressure in those patients that have an elevation. Things such as exercise, appropriate diet, appropriate weight maintenance can all help prevent the development of high blood pressure. Unfortunately, blood pressure can also be hereditary and can run in families. So if there's a family history of high blood pressure, it's very, very important to maintain normal weight, to have your blood pressure checked frequently, and if it is persistently elevated, to consider some either dietary modifications or even some medical or medicine interventions to help decrease the level of the blood pressure.